Welcome to the Auburn Medical Group YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Mark Vaughn and Dr. Gwen Vaughn.
Hello, and welcome to the Auburn Medical Group live stream with Dr. Mark Vaughn and also Dr. Gwen Vaughn.
That's me.
And we're going to be talking about time management.
Ooh.
We're also going to be talking to our friends, because it's a live stream, who are on chat. And right now in the studio with us is Mr. Ed.
Hey.
Today,
Mr. Ed, welcome back.
Welcome
you were out
back.
for a couple weeks.
I was visiting family in other states.
Oh, excellent.
Okay, well, we're glad that you have family in these
Glad
days.
to be back with you guys.
Excellent.
So time management, you can find some writing about time management in the Dr. Green Knight blog at drgreenknight.com.
Yeah, check that out.
And I would have already put a link in the description, except I didn't. Maybe I will
come on.
shortly after we finish the live stream, and so people watching it later will be able to find what you wrote, because it was good stuff. You really actually thought about it and wrote about it, and I just lived it.
And you just lived it. Lived experiences.
We have greetings from Rusty Bernard and Lindsay Antoine already.
Hello.
Thank you.
And Bianca.
And Bianca
Oh,
also.
welcome.
Oh my goodness, so
She
many
says hi.
people. Oh, Bianca, yeah, I see you right there. So some of our regulars, thank you. We're glad that you are a part of it and watching.
And Teresa.
Oh, Teresa's there too.
They're all
Hello,
showing up.
Teresa. Yeah, we like to have everybody go ahead and greet us through the chat. Oh, what? Oh my goodness. Welcome back, Mr. Ed.
Thank you.
Yes.
Thank you.
Oh, Lindsay, what a way to start off the show. She's really glad to have Mr. Ed back.
We all are.
I guess so. Thank you. So time management. What inspired the topic of time management? Why did you write about that?
It was an interaction I had with you, strangely enough.
Let's see. I think this happened. Was it Friday morning?
No, it was
Thursday.
Thursday, because I don't
Thursday.
think you had. No, it may have been Friday, but you
Maybe on
didn't.
Friday
You didn't
morning.
have a medical student Thursday, so maybe
Oh,
that
that's right, I
had
did.
kind of primed you for
So-
having some thoughts,
Oh man.
feelings.
Yes,
on
it was Friday because I had the medical student Jimmy, who our audience would remember from last week when
That's right.
he was filling in for Mr. Ed, and the week before that when he was filling in for Dr. Cooley. Jimmy with no last name. Jimmy's. Oh, what? Deborah, welcome
Hey,
too.
Deborah, thank you.
Wow. This is just super chat
so
day.
happy to have us back with our normal team.
And we're glad to show people that super chat is a thing. You can use it. And
Yes.
it helps to cover the Where's the Dutch Brothers? We'll have to show his because I finished mine.
Already pounded it.
And you already finished yours. You already pounded?
Mine is right here, frozen solid.
Okay. Oh, well, it's out of the camera. Show it in the camera.
Oh, you gotta bring
there
it
it
up
is.
right
There, okay, there's
There
yours.
you go.
He got the fruit freeze. He's healthier than
And
us.
it is frozen.
Sorry about that. I got it early. I had to put it in the
when it's
freezer.
raining
So now it's-
outside.
It's awesome.
Perfect drink.
Well, it was sunny when I got it.
That's right.
it's
The,
sunny
the,
now,
the
too.
sun peeked through for a little while.
Speaking of interesting things going on outside right now,
yeah.
I don't know if you can hear it, but we can hear it. We can hear it. A chainsaw and I think a wood
wood
chipper
chipper? Yeah.
because a tree fell down just outside of the other half of our building.
Parking lot, yeah.
And they roped off the parking lot and
Did it nail any cars?
It was exciting.
Just
it was
missed.
not that exciting, which is
just missed the building on one side and just missed
Yeah.
somebody's parked car on the other side.
Wow.
Huge branch of this oak tree fell down
It was.
into the parking lot. Totally
Yeah.
went across the parking lot. And this was after we started work today.
right
Did anybody hear it?
up front.
The front desk heard it
we
when
were
it
kind
hit.
of in the back.
So exciting. Thankfully, nobody got hurt. Thankfully,
Yes.
no cars even got damaged. And people were able to get to their office somehow because I saw they moved their cars out to the parking lot while they're chopping it up. So it'll be all taken care of. And we'll talk about time management, which was inspired by an interaction with patients.
An interaction. So that day, you had you were not as eloquent in the words that you said when you came out of a patient's office. Let's just say that. Yeah, you were really upset that a patient had set you behind.
People are excited that you're talking about time. Bianca says, I'm bad with time. I try to be on time, but I'm always late. And then Lindsay says, Bianca, same thing. I have horrible, untreated ADHD. Time has no meaning to me.
Time has no meaning.
It's relative.
That's a good way to put it because
Sometimes when you're in the office,
there's some patients that time has no meaning. Okay, so the experience was, it was a patient, the student was seen, and I came in, because I always do that. I introduce the student, leave them for a little bit, and then I come back and have the student present to me what the patient did. I should have done it in front of the patient so that the patient could see I already had the whole story, so they didn't have to say it all over again to me in excruciating detail, including family members that have nothing to do with it, and details of their hospital experience and their doctor's name. And anyway, it goes on and on and on, and I don't need to know names. Don't need to know who's related to who, unless it has to do with family history of medical problems. I don't need to know about pets unless a pet bit somebody or scratched somebody, or may have given some kind of illness,
or bucked you off. And
that's true.
The horse's fault.
Lots of horse injuries here. It's never the horse's fault. Yeah, somebody, if they're up to date on their tetanus shot, and for some reason the next thing that comes out of their mouth is, I have horses.
Strangely.
That's not what I asked, but I understand. I get it. We'll get you updated. So, the whole story plus, and Dr. Gwain will tell you about the hand on the doorknob, oh, by the way, but for me, what I'll express is the excruciating detail that can sometimes be used in the tangential stories that, we are really, I think we're quite good, at least according to the surveys, we're quite good about seeing patients on time. Mr. Ed, do you feel like you get seen on time when you come to this doctor's office?
Well, after the first 45 minutes of waiting, I'm asleep. Yes,
liar.
doctors, you guys are good. Both of you are very good.
All right, thank you.
45 minutes.
Because, doctors have this reputation for making patients wait, and it's totally inexcusable. You can control the schedule, and if you're always falling behind, then you need to change your schedule and not pretend that you don't fall behind. That's dishonest, and it's not looking at the data. It's not data-driven, and it's not, what's the word we always use for informed practice of medicine? Evidence-based. If you've got evidence that you're late, and you're always late the way you're doing your scheduling, then change your scheduling. And that's my message to other doctors. And what do they say when we tell them to change their scheduling?
I can't.
Yeah, why is that?
I don't know.
They say that they can't afford to.
I have heard that one.
So,
which doesn't make sense because we work with
doing it.
Independent practices, meaning that the doctors own the practices and are the decision makers within them, not what's some bureaucratic force above them.
It says either they are poor at business or they're making more money than us and feel like they need to.
Maybe the latter.
But I hear music.
There is music.
That's my phone. I'm sorry, guys.
Hey.
We ask our audience members to turn off their phones. Oh, wait, they're watching us on the phone.
Don't turn off your phone. Don't do it.
Wait. Too late. They already turned us off.
Enjoy our elevator music.
It feels like I'm falling. So where did I leave off with? Oh, yeah, my rant about doctors scheduling. So make each visit for longer. And we have different types of visits. We have visits for the full, annual physical for people who still get physicals, or an annual wellness visit for people with Medicare who don't get a full physical. There's still a certain amount of dedicated time, or a regular visit, or a procedure, or just coming in for a recheck of something. We have these designated times. And some are shorter and some are longer, but they're all very generous so that we're pretty good about getting in on time.
Right.
To the next patient, not making them wait because their time is valuable, and it's rude to make people wait when you have an appointment.
I want to stop there for a second and sit on that. People say that the doctor's time is valuable, and our time is valuable. However, you made the point that the patient's time is valuable too.
That's why our time's valuable, because it represents the next patient.
Yeah.
And the patient after them.
Because we like to stay on schedule, and we do a very good job of it, and we it's almost like a respect issue that we are showing our patients the same respect that we we like to be shown as far as time is concerned.
Absolutely.
If you make an appointment with us, we expect you to show up because our time is valuable. We scheduled that appointment to be with you for that time. So if you call us the morning of, we're a little disappointed because then we got this gap in our schedule. Because our time's valuable, that could have been used by somebody else, and then if it's that morning, it's tough to get that filled.
Especially if it's somebody we sent off to urgent care because we didn't have room for them.
But then on the same side, we know your time's valuable too. You're coming in, you may be taking time off of work to see us, and that's something that we need to value, that we need to take into account and make sure that we're
back to work after.
Exactly. So we need to stay on task, stay on our schedule, and make sure that, hey, if you have your appointment at 10 a.m. and you took an hour off, we want to get you out of here back to your work by 11.
Yeah. So part of the whole experience in an exam room when I'm the doctor is to let the patient feel like there is no time. Give them the time to say everything they need to and to listen to them. And I don't tell them about, because I know it on my schedule, the patients that are in other rooms or being roomed in other rooms who are also waiting for me. I try to have the visit reach a natural end and then just go from one into the next, ideally. That'd be the best most efficient use of time, without them needing to know that there was any kind of time pressure at all.
That if you're ahead of your schedule or behind on your schedule or
so I don't say, hey, there's a patient in another room and another one after them already being roomed. So get on with it. So instead, I just kind of absorb it.
That being said, I do say that at times, but I say it in a way that is respectful. I mentioned that next person. So this is only when we're getting 10 minutes beyond where we should be. I bring it up tactfully and say, I have my schedule to keep and I need to be wrapping it up here to see my next patient. I say that, and patients accept that very well.
Maybe I should do that more.
Yeah, maybe.
All right.
That's one technique. I don't know. How would you feel if the doctor brought that up to you? If you were...
We have people in the chat right now.
Let's ask. You tell me. If a doctor said that to you, and you had essentially done your visit time, we're coming to an end of it, and typically I, at that point, have taken care of what I feel is appropriate for the visit. Yeah. It's usually those ones that get a little derailed and are going off on stories that may not pertain to the visit. I'm perfectly fine interrupting those folks, and I love you people, and hey, other places, let's have a conversation, but in the doctor's room, not exactly the place to be telling me about your dog.
Says our doctor is limited to 10 minutes. And they kick you out.
And most of the bigger medical foundation places where there is doctors who are employed by a company essentially, they got to keep those doctors in task, and the doctors aren't able to make those decisions. That's one of the reasons we are in independent practices, because we don't like that. We like giving patients more than 10 minutes of our time.
It makes it less stressful on us, and the patients get
everybody.
better care.
Oh my goodness, yeah. And we get out of here by 5 o'clock because we've completed our notes. We leave a little time for that to complete our notes while we're going. And I haven't burned out yet. Where are you at on that?
I'm making an adjustment from direct hands-on patient care to being a teacher and being the supervisor of our PAs. And I like that. I love coming into the room, helping a PA or a student with question of management of the patient, interacting with the patient, sometimes doing a procedure that they're not comfortable doing, and then not having to document anything. Just maybe sign my name on the chart saying, I was a part of this. I helped manage it, but I didn't.
We made them.
I don't like the paperwork
cleared
part of
all of these medical decisions.
And I don't have to spend all that time pulling all that information out and doing as in-depth of an exam, just covering up on, following up on whatever they said they found, and helping them learn along the way. So that's my transition of my career here, 12 years ahead of yours, I guess, or something like that.
Well, Deborah is saying my doctor scheduled me for 2 appointments.
That's one way to do it.
One time, that way he is enough.
Like back to back, I'm guessing that's how I'm understanding it, yeah. So you have twice the time. You have 20 minutes.
Yeah. Okay, so let's talk about it. Let's give them a little insight into billing.
Oh, sure.
But first, the hand on the doorknob, oh, by the way.
Sure.
Explain that, because you wrote about that.
So this is what I wrote about, and you can go check that out, drgreenknight.com. But it happens where more often than it should, where we've completed the visit, we're walking out the door, maybe even gotten up, and our hand is literally on the doorknob.
On the doorknob,
ready
or turning
to
it.
Walk out of the room.
You hear the little springs making noise as they stretch.
And the patient says, oh, by the way, doctor. Uh-oh. And they bring something up, some concern that they have that was not addressed in the visit. You've completed everything that they came here for. I say, oh, by the way, I have this concern. I've been having this strange crushing left-sided substernal chest pain. They won't say that. But that radiates to my left shoulder.
Worse with exertion.
Worse when I want.
Associated with shortness of breath.
Yeah, it happens that sometimes, actually probably more often than not, those are more concerning, symptoms that need to be worked up. And then we need to work them up there. We can't let you go home if we think you're having a heart attack. So we've got to do an EKG. Yeah. We've got to, possibly make a referral. It's a whole nother visit.
Yeah.
And just when, that extends this visit where you were walking out the door, getting into the mindset of seeing that next patient to another 30 minutes.
Because we managed the time to go to the next one right as our hands on the doorknob.
So don't do that to your doctor.
Yeah, so we encourage.
So I kind of go over in my blog on how to avoid that. Make a list. That's kind of the long and the short of it.
Yeah.
The TLDR is make a list, but read it anyways.
And then the list we can go over together and decide. Okay, the chest pain that you think should be at the bottom of the list. That needs to be addressed, and then
we'll see that. We'll see that. Hey, but what is this?
They may have something that's more important to them.
To them, yes.
So let's try to get that in also, and maybe some of these things down lower in the list. We'll schedule a follow-up visit to get to that. And it's because in primary care we cover everything.
We are the end-all, be-all.
Everything. Some of it we'll take care of. Other we'll evaluate, and then we'll pass along to somebody we refer, consultant we refer the patient to. But we want to know up front, so that we can work out. Other specialists don't have to deal with this. I mean, I hear all the time, I can hear the voice ringing in my ear here of the orthopedic specialist when you go to them for your knee and you say, what's this rash on my hand? And they just say, go to your primary care doctor for that.
Man, I wish I could say that.
And this is true for every other specialty.
Wait until the other Dr. Vaughn's available and make an appointment with him.
Lindsay has the right idea. She makes lists.
Oh, thank you, Lindsay.
That I want to talk about so I don't forget and do by the way thing. Yeah, she's very aware of the doctor's time.
We appreciate that.
With prescribed pain medicine and then Tylenol and then the non-steroidal anti-inflammatory, that's what her list would look like. Referring to something from a little earlier today. So you covered, by the way, with the door handle, we covered negotiating the list. I've actually had patients not let me see the list and pull it away as I try to look at it.
No, why?
Because
it's not secret.
They want me to address each thing individually and not let me know what's coming.
Yeah.
And that's not
helpful.
No, I'm going to walk out the door.
You're kind of sabotaging yourself when you
however
do
many
that.
minutes.
Yeah.
Or just tell you to go see somebody else, which I say that more often than I probably should. Very comfortable with those words. What a therapeutic alliance, doctor who shares the same values.
Yes. If you read my previous blog post.
Oh yeah, you did.
On the patient experience and why it's important.
You went over that too. Okay, so your comments and questions. Rusty says, well, hey, that's Mr. Ed's job. I'll let him do it.
Oh, TDLR, too long, didn't read.
I said that, didn't I say that?
Yeah, I did hear you say that. I didn't know what it meant, but too long, didn't read.
TLDR.
Yeah, that applies also to what people are saying when they come in. But we are comprehensive, so we do want to cover all this stuff. So I said we get back to the billing with 2 visits back to back.
Yes.
Well, medical billing does allow for billing just simply based on the time you spent with a patient, and there's certain intervals. I think is it 20 minutes, 30 minutes, 40 minutes,
recently.
or 25?
We rarely do it. That's why we don't know these numbers.
And the reason we don't do it is because if you're waiting until you meet the minimum for time and then bill for that higher level of service, you've lost.
Yep.
That is financially, that is losing. So what we have to do is get the amount of work done and write in the note there's a way for describing how complex a patient's visit was, how many things you went over, how many simple things you went over, how many more complicated things you went over, or chronic diseases that were either stable or you made changes on. And there's this whole calculus to it that's not actually really straightforward arithmetic. There's a lot of subjectivity to it. So we use that. And using that, you're just not going to be able to address everything that everybody comes in with,
right?
And have it be at all fair to the medical provider. So we do our best to try to keep up with what patients need done.
Yep.
And sometimes I'll admit, sometimes I just fall back on, okay, this is something we could totally take care of, but I'm going to refer it out because we can only take care of so much. And the stuff that we need to be on top of and that needs to be, a priority to take care of, we'll address that. And
well, also sometimes when
out.
you have that long list, it's tough to give your full attention to every one of those. So I have found myself when I see that longer list trying to take care of all of those at a single visit to just refer some of them out because I just don't have the bandwidth and the ability to address that. Whereas if possibly we'd made another appointment, I could address that without having to send you to a specialist.
That's true. Making a separate appointment for it, even though it's terribly inconvenient for the patient to come back in another time, or telemedicine, it does allow us to do what, if it's something we can handle and it doesn't need to go to the specialist, we can probably get them in sooner than a specialist would.
Right. Yeah. Usually true.
But we need to have more frequent appointments to keep up with how complicated the more complicated patients are. Okay.
Sounds good.
Yeah. All right.
Administrative staff. How many times do you proof the things that they put together on paper and make sure it's correct?
Well, we're supposed to every time, and I'd say we do almost.
Let me read a few things that you may have to prove.
Mr. Ed.
Wait, what's going on?
He's going to read
Are we being put on the stand?
No, it's
Here we are.
No. It's just the mistakes that clerks make.
Okay.
And you get to correct them, okay? Like, for instance, this one. The patient has left her white blood cells at another hospital.
That sounds like a dictation error, which I've got plenty of dictation errors if you want to go check out drgreenknight.com. Just to type in dictation errors. Yeah, there are plenty.
There's about another one here. The patient has chest pains if she lies on her left side for more than a year.
For more than... Would a comma take care of that?
You probably need to reorganize that sentence.
Maybe make two sentences. That would work better. Lies on her left side for more than a year.
On the second day, the knee was better. The knee was better, and on the third day, it disappeared.
Yes, I've probably written notes similar to that myself. Yes.
Oh man.
Yeah, it looks like he's still going.
There's more, but wait.
Oh yeah, several. The patient has been depressed since she began seeing me in 2001.
Cause and effect.
Discharge status: alive, but without my permission.
Oh, discharge without permission. I get it.
Patient had waffles for breakfast and anorexia for lunch.
Oh, man.
Oh, okay, I get that one too.
Yeah.
So that would be confusing to someone that thinks anorexia is just anorexia nervosa,
not wanting to eat.
Anorexia, defined as loss of appetite. Yeah.
Well, in ER.
You're still going.
Well, in ER.
Still going.
Ava was examined, X-rated, and sent home.
X-rated?
X-rated. Yes, there have been patients like that. Yes.
That's why the gown's open in the back.
Thank you for saying that. I mean, we just need to get that message out more. There should be billboards that say the gown opens in the back.
Opens in the back. If anybody doesn't know that.
That's what we should have written on the front door as people walk in. Not our names and our degrees.
Open in the back.
The gown opens in back.
Yes. Yeah.
Just a few more, guys.
Okay.
Patient has 2 teenagers, but no other abnormalities. Okay. Another one. The patient was in his usual state of good health until his airplane ran out of fuel and he crashed.
That will change that.
She's numb from her toes down.
From her toes down?
These were corrected statements that you found in your reports or your whatever.
That I found?
No, these, yeah.
And one more.
I try to correct mine. I have had plenty like that.
Oh, here's one.
You got to read your dictations.
And the
Gotta put in commas.
The patient refused autopsy. These are corrected statements that the doctor had to monitor. Had to look at and revise them.
Yeah, you catch them when you go back and sign your notes.
Oh, well, I've done that many times.
Yeah. So, in the last comments there, lots of people laughing at your jokes there. Teresa and Deborah, they both are using the emojis there for. And Bianca, boy, all the regulars.
Don't the emojis come up different on the...
they're described.
The laughing, crying face.
Yeah. So if you want to make sure that you have your name on the video, like these regulars we have here, you can find out at Patreon. There'll be a link somewhere in this part of the video very shortly. Until next time, Dr. Gawain.
Hey, Dr. Wayne.
And Dr. Mark Vaughn telling all of you, and who do you need to thank?
Oh, yeah. Yeah, I have my own Patreons over at Dr. Green Knight. Teresia Rowatt, she gets her name mentioned over there.
And Lindsay Antwine, whose name you'll see here shortly because of what she does on Patreon. Until next time, Dr. Gawain Vaughn and Dr. Mark Vaughn telling you to stay in good health.
Doctors, thank you for another informative session. Auburn Medical Group is located in Auburn, California, USA. Thank you for participating. Please tell a friend and join us again next week.